A Topeka family did something this week that no one should ever have to do. They had to bury their 11-year-old daughter, sister, granddaughter, niece, their friend. This is Emma Williams. Last week, the sixth grader took her own life. After Emma's death, one of her sisters reached out to us, and tonight, with their mother's permission, she wants you to know Emma so you never have to know her family's pain. This is the Emma her family will remember, full of life, leaving silly videos on her mom's phone.
She was a jokester. She's just very outgoing, very friendly, really good friend. When we'd have someone new move into the neighborhood, she wouldn't hesitate to just go over there and introduce herself.
At 24, Jordan Messbarger is 13 years older than her little sister. A big gap in years, but always close in their hearts.
She was my mini-me for sure. She would always want to go with me everywhere I would go.
Which is why Jordan and the rest of the family cannot understand how Emma left them. Last week, at just 11 years old, Emma took her own life.
I want to believe that it's a dream and that I'll wake up.
But it is real, and surrounded by memories and the silence of her absence, the family wants Emma's voice to be heard.
I feel like the worst part about suicide is not talking about it. I feel like this is my chance to help other people, help Emma, we don't know what she was going through, and I feel like getting this message out there will help a lot of people.
Jordan says speaking out is vital since she believes there are many people like Emma who show none of the traditional warning signs.
They're not alone. People need to realize that. It's okay to come forward. It's okay. You're not going to get in trouble. Reach out to someone.
Reach out so you can know now what Jordan wishes she could tell Emma just one more time.
That I love her and that I miss her a lot.
Emma's mother and stepfather were there with us today. They did not wish to appear on camera, but they did say they're so grateful for all the support their family has been receiving. If you feel you need help, you can call the National Suicide Prevention Lifeline anytime. That number right there on your screen, 800-273-8255. And Ralph, their family was so gracious. They had reached out to us.
Right.
They felt that, this is something people don't really like to talk about, but they say it's such an important issue. We need to talk about it so that kids know, young people know, young adults know, no matter what age, that they can come forward. There's help out there, and people do love them. They said Emma truly didn't have those traditional warning signs of, withdrawing and not looking forward to things. At age 11, they said she had decorated for Christmas. She had a shopping list and things she wanted to get people. She had gotten her first solo in the choir concert. So a lot of things to look forward to. It really was without warning. So then it becomes incumbent on the young people feeling comfortable about speaking out for those things that we can't see are going on below the surface. It's something we talk about often with our military veterans, and you've seen the numbers. 22 a day take their own lives. It's raised a lot of awareness about PTSD, but there's an equally vital battle going on with the men and women on the front lines keeping us safe here at home every day. As many as 37% of firefighters and paramedics have PTSD to some extent, and in a Florida State survey of firefighters last year, nearly half admitted to thinking about suicide. Tonight, one firefighter opens up about his journey, and we see what's being done to heal our heroes. Scott Price never thought he'd trade his big red truck for a set of yellow wheels.
I was in the fire service for almost 24 years.
He was driven by the excitement, a desire to help.
You do have those moments where, you've delivered a baby or you've saved somebody's private property or their belongings.
But those other moments,
A lot of fatalities, numerous children, drownings.
Shifted his life into reverse.
For any firefighter, children are difficult. For me, it was happening over and over and over again. A lot of calls that I would like to forget that I'm just never going to forget.
The one he couldn't bring himself to tell us about, the 2012 death of Savannah Edwards, fatally mauled by a dog. In the months and years that followed, Scott saw the changes.
You're not the person that you used to be. I was a little more fatigued, a little more temperamental. Nightmares so bad I wouldn't even want to go to sleep. For a while, I thought it was something that we all dealt with.
Finally, this spring, Shawnee Heights Fire Chief Tom Garcia pulled Scott aside.
It was affecting his family life. It was affecting his work performance here.
Together, they got Scott into treatment, where he was diagnosed with post-traumatic stress disorder. Garcia says it's not surprising, since firefighters today do more than just put out flames. They're also the first responders for anything from wrecks and assaults to medical calls and suicides.
It's the day in, day out. We can't get away from it, because the next day we come to work, we don't know what we're going to be faced with. So when we get up in the morning, we try to prepare ourselves for the worst.
Trauma rewires the brain.
Clinical therapists Jill Reese and Mary Evans say PTSD is very real. The brain becomes stuck in fight or flight mode.
They continue to live with intrusive memories, distressing memories, flashbacks, dissociations. Maybe they start avoiding things.
The good news is it can be treated, but it takes an individualized plan of therapy, sometimes with medications.
Their mind, their body's been hijacked by the trauma. We teach people skills such as relaxation training, mindfulness skills, so they can kind of develop a sense of mastery over some of these symptoms.
The first step is trusting there is help, which is where the 1033 Foundation comes in.
Because it's all about how this person's being affected.
Named for the common signal code of officer in distress and the verse in Luke, where you'll find the biblical story of the Good Samaritan, 1033 Foundation trains first responders to encourage peers to reach out and take the first step. Soldier Township Fire Chief Carl McNorton helped launch it here in March when he saw how handling several tragedies involving young people in recent years was affecting his crews.
It's really critical to us and to me personally that we do what we can to help each other and help prevent this, because I'm an old firefighter and I want to make sure a young firefighter gets to be an old firefighter.
Because they know what's at stake. October 15th, Indian River County, Florida Battalion Chief David Dangerfield posted on Facebook, PTSD for firefighters is real. 27 years of deaths and babies dying in your hands is a memory that you will never get rid of. My love to my crews. Be safe. Take care. Less than 3 hours later, Dangerfield drove to the woods, called 911, and took his own life.
We are working in an industry where being macho is what we should be. We're going to run into a burning building, we can save everything. That's not reality. We can't save everything. We need to be macho enough to say, hey, I'm a big enough man to step up and say, there's something wrong.
Which is why Scott is speaking out.
I know there's more people out there. You know, I've seen the look.
He ultimately decided to take early retirement from the fire force and steer in a new direction, but he wants his friends to know they don't need to travel as far down the dark road as he did.
Just listen to the guys and just say, you know, look, you might be in trouble or I'm in trouble and I need help and I need you to listen to me.
You can find more about the warning signs of PTSD and resources to help on WIBW.com. And we're also going to tell you a little bit more about the 1033 Foundation tomorrow on 13 News this morning. All important information. And as Scott said, he just wants to help and tell everybody else to open up. And as I've said, it's very interesting that both Chief Garcia and Chief McNorton both said, you know, that's something that they've dealt with as well and have recognized in themselves. So they are, we're very interested in spreading the word as well.
Melissa, I'm sure the important thing for all of us to remember, we think of PTSD with military members, and you've brought out the issue with the first responders, and not forget about that.
And I said they take a lot of their cues from the military, so they're hoping this is another one that they can learn lessons from too.
Okay, awesome.
It's being called a national epidemic, and it is likely in your home right now. The very drugs that are supposed to make us feel better are fueling addictions and deaths. Just today, the Surgeon General released a first ever report on the crisis. Tonight, we investigate what's happening in Kansas. We are a nation that likes to feel good. No need to live in pain. Don't have to. We have drugs to help. And we're hooked.
For a long time, the policy was no matter what, give people what they need.
Dr. Eric Voth is Chief of Pain and Addiction Medicine at Topeka's Stormont Vale.
I think we are all in the medical world sensitized to trying to treat pain and trying to get ahead of pain and keep people pain-free.
But it's had deadly consequences.
The reality is narcotics are dangerous. You take too many and you can easily overdose.
In Kansas, drug poisoning deaths increased more than 121% in the past 15 years. It's attributed largely to the increased use of opioid medications, drugs like OxyContin, Percocet, and Vicodin. In 2015, more people died from poisoning than motor vehicle wrecks or firearms. In young people specifically, the Kansas overdose rate has quadrupled. Only Wyoming saw a bigger jump. And nationwide in 2014, the U.S. saw more than 270,000 deaths involving prescription opioid medications or heroin. That's one death every 20 minutes.
The big trick here that's different is that a lot of the drugs they abuse are legal, and you can get them through legal channels, and it doesn't take a lot of manipulation to get them.
Which is why the healthcare community has launched a whole-scale treatment plan to sew up those loopholes.
We're going to do a patient search.
The K-TRACK system is one tool. It stands for the Kansas Tracking and Reporting of Controlled Substances Program, a database that captures information on all prescriptions for controlled substances written and filled by participating doctors and pharmacists.
It's just a tool to give them additional information about prescriptions that have been filled by patients that might have drug-seeking behavior, shopping behavior, and so that you can always check in on a patient before you write a prescription or fill a prescription.
Program manager Renee Canton showed us how the information on K-TRACK offers clues.
30-day supply is only lasting them 5 days, and they're getting another one in 5 days. That is a good indication that you may have a shopper. We have 2 prescriptions that were written on the same day for the same drug.
So that would be a concern.
That would be a concern.
The system also issues an alert if a patient has used 5 doctors and 5 pharmacists within 90 days.
It brings it right up in the doctor's face. This person had 13 prescribers, 9 pharmacies in a matter of 90 days.
Between July and September, K-TRACK alerted on 221 people potentially shopping doctors for prescription drugs, giving those doctors a shot at intervening. It could head off addiction before it starts.
Yes. I think it's a way that doctors and pharmacists can help patients who do have issues.
But it's not perfect. K-TRACK receives more than 16,000 inquiries a day as it shares information with more than 24 states. When it doesn't, Missouri, currently the only state in the nation without a statewide prescription drug monitoring program. Plus, K-TRACK can't always account for a patient using a false name or birth date. And while Stormont and St. Francis are among systems encouraging its providers to use it, and a White House strategy to combat the opioid epidemic recommends the programs, so far only 7 states mandate it.
Obviously, in the healthcare setting, time is of the essence. And so taking the time to go into an additional system, log in, return information, even though it only may take a few minutes, we're trying to make that process a little bit easier.
Via Christie received a federal grant for a pilot project to integrate K-TRACK into its computer systems, including its facilities in Manhattan and Wamego. And healthcare systems are taking other steps. In May, the CDC issued its first guidelines for prescribing opioids. In keeping with those, at Stormont, Dr. Voth says patients who receive a narcotics prescription will sign an agreement that outlines risks and refill policies, and it won't be your first option.
If you just had surgery, maybe you'll get a week's worth of some narcotic. In most primary care offices, if you go in and say, oh, my knee hurts or something, you probably won't get a narcotic.
Law enforcement, too, is part of the equation, stepping up awareness of its drug take-back days so extra meds aren't sitting in cupboards, waiting to get into the wrong hands.
Prevention's really got to take place. Everybody needs to pay attention to this.
Now, another reason this is so concerning, the U.S. Attorney's Office estimates nearly 80% of new heroin users started by abusing prescription opioids. They turn to heroin because it can be more accessible and less costly on the streets. While Kansas is not seeing the huge heroin problems other parts of the country are, it is showing up. The KBI told me heroin seizures in Kansas increased 36% last year and are projected to nearly double again this year. Also concerning, synthetic opioids, considered 8 times more powerful than morphine. They are suspected in deaths in at least 4 counties this year. The KBI will be asking lawmakers to get them on the controlled drug list this year. They're not right now. And as for K-TRACK, its future is uncertain. It costs about $500,000 a year, and right now they get that money from grants and surplus fee funds in the Board of Pharmacy. That all runs out at the end of June, so they're going to have to come up with another way. As you can see, Ralph, a multifaceted, very complex problem. New information coming out every day, and we are going to be seeing legislation in Kansas in January, so we're going to be following up on all of that to see how people are going to work to try and get ahead of this problem before we see the huge happenings here. It is a disease with a very long name that can lead to a whole wide range of problems. Neurofibromatosis, that is how you say that word. Most people will just call it NF for short. NF can cause tumors to grow on your nerves, and we have nerves everywhere in our bodies. These can be disfiguring, disabling, and sometimes even deadly. So tonight, during NF Awareness Month, we share the inspiring story of one young fighter who's painting a vision for a brighter world.